Umbilical cord care is not discussed that much in the postnatal period, and it's actually very straightforward. The main things you have to remember is how to prevent infection, keep it clean and dry, and also promote separation of the cord. I'm here with baby Mason. He's 3 days old and he's going to help me to show you how to look after your baby's cord. Now, the main thing that a cord needs to enable it to drop off correctly at the appropriate time is to make sure it stays clean and dry. To do this, it's important that the cord remains outside of the nappy. Now, with normal nappies, you can fold the top of the nappy down, but there's these new nappies that have come out which have got a cutout area which enables you to actually leave the cord outside of the nappy without having to fold the nappy down itself. Always make sure with a little boy that their little penis is pointing downwards. Now, very gently this can be done, and the main reason is that the baby doesn't wee up into the cord itself, which can obviously make the cord moist but also encourage infection in the cord area. Now, with regards to cleaning the cord, routine cleaning is not recommended. If it's covered in poo, it's advised that you do clean it, but just with normal water would be fine, and you would wipe it round the base, as so. Avoid using dry cotton wool to dry off the cord. You don't need to do that, and the main reason is that it can leave little filaments of cotton on the actual cord itself, which will encourage infection. So leave it to dry naturally. Another thing you should consider is the types of clothes that your baby's going to be wearing. If you've got a tight-fitting top over the cord, it will actually rub on the little one's tummy. It can be quite uncomfortable for them. So a nice loose-fitting top on top of the cord being outside of the nappy will allow air to circulate around the cord and enable it to dry naturally and cord separation occur. So, how will you know if there's anything wrong with your baby's cord? There's 4 main telltale signs. There's redness around the base of the cord, discharge coming from the cord itself, quite an offensive odour, or bleeding from the cord. Now, the bleeding can actually happen at the time of separation of the cord and isn't anything to be concerned about. But if any of these things happen and you are concerned, you should immediately speak to your midwife or health visitor, especially if your baby's generally unwell or feverish in association with it, because the baby may well need antibiotics. So with a healthy cord, the cord will remain moist for 2 to 3 days following delivery. Then it will start to become hard and dry and black and eventually drop off. Then, even after the cord's dropped off, which is called cord separation, the actual stump should remain free from infection for 7 to 10 days. So if you follow these tips, I'm sure it will give you time to focus on your new treasure and give you time to enjoy the wonders that your newborn baby will bring to you.